Do you need an X-ray or MRI? This is a common question that we get as physical therapists all the time. My name's Dr. Eric Broadworth.
I'm Dr. Hayley VanBeek.
And we are going to answer just that question for you today of, do you need an X-ray or MRI? So Hayley, what do you tell your patients when they ask, do they need an X-ray? When do you recommend it?
Yeah, so an X-ray really looks more at bone versus soft tissue. So, if somebody's come in and maybe they were either in an accident or they had a pretty significant injury and they're having trouble bearing weight on their leg or their arm, then this might be more of an indication of an X-ray to just really help rule out a fracture. Otherwise, to rule out more soft tissue injury, we probably need a little bit more of an MRI, which is what, Eric, you're going to talk about a little bit more of.
So with an MRI is going to be able to show more soft tissue changes. So looking at tendons and ligaments and muscles and determining was there any type of tear or damage and what do you need to do. However, when it comes to MRIs and whether they're necessary, what I explain to people is a lot of times it's the most expensive selfie that you're ever going to take. So MRIs can be very costly and oftentimes are unnecessary. So for example, if you have been having chronic pain that has lasted, say, 6 months or greater, and you have not tried any conservative therapy or care yet, such as physical therapy, chiropractic, you haven't done any of that, a lot of times, if it's already been 6 months, that tissue has healed. Now, as a physical therapist, I'm always going to ask you certain questions and determine, do you have any what we call red flags? Have you had a fever, any unexplained weight loss or weight gain, any history of cancer, any infection? All of those things could possibly indicate that, yes, imaging such as an X-ray or MRI may be necessary. But if not, if you don't have any of those things and you haven't seen a physical therapist or a healthcare professional yet, typically that's then not going to change how we evaluate and treat your issue, whether that's chronic low back pain or a shoulder issue, knee. So getting a very thorough evaluation is necessary in determining, is imaging appropriate? Because oftentimes that we find that it's not appropriate and just adds to the cost of healthcare, and which is unnecessary and can also lead to some unnecessary treatment that can just be treated with physical therapy. Now, everyone's situation is different, and ultimately we recommend being treated and evaluated first by a healthcare professional, such as a physical therapist like myself or Dr. Hayley here. So I hope you found that beneficial. If you have any questions or comments, please leave them in the comments below, and we will do our best to answer that. You can also contact us via email at eric@fuelphysicaltherapy.com or hayley@fuelphysicaltherapy.com. You can also reach us via phone at 616-965-1159. You can call or text that number, and we hope that answers your questions.